As scientific literature continues to accumulate on the connections between nutrition, oral health, and systemic health, the growing body of research opens a door to new opportunities in the practice of dentistry and medicine. Moreover, some more recent publications help to establish that the threshold of nutrition must be crossed in order to prevent disease and to achieve more optimal levels of health. Following are just a few examples of innovative new research articles addressing these concepts. Quote, respectively, there are two major fields concentrated on the interrelation between genome and diet, nutrigenics and nutrigenomics. Nutrigenetics studies the effects of nutrition at the gene level, whereas nutrigenomics studies the effects of nutrients on genome and transcriptome patterns. By precisely evaluating the interaction between the genomic profile of patients and their nutrient intake, it is possible to envision a concept of personalized medicine encompassing nutrition and healthcare. End quote. This comes from Al-Ermi et al., Medicina, 2019, June. Quote, during the last decades, the importance of micronutrients has been extensively reviewed, and it was concluded that the prevention and treatment of periodontitis should include correct daily nutrition and a correct balance between antioxidants, probiotics, natural agents, vitamin D, and calcium. End quote. This is from G. Isola in Nutrients, 2020, February. Quote, among middle-aged adults, poor quality diet appears to be associated with the development of periodontal disease. End quote. This is from El-Aim Jahanan et al. In Community Dentistry and Oral Epidemiology, 2020, April. Quote, a pediatric dentist performed an oral exploration of the participants according to the criteria of the World Health Organization, or WHO. Food rejection and limited food variety were associated to an increased prevalence of malocclusion and altered community periodontal index scores in children with ASD, or autism spectrum disorder. End quote. This is from B. Leyva Garcia et al., Journal of Autism and Developmental Disorders, 2019, December. Quote, in patients with stable coronary artery disease, or CAD, the presence of periodontitis and tooth loss were associated with a poor dietary intake of nutrients and healthy foods, which are important for cardiovascular prevention. End quote. This is from Didi Mendonça et al., the Journal of Periodontology, 2019, October. Quote, saccharolytic bacteria, including Streptococcus, Actinomyces, and Lactobacillus species, degrade carbohydrates into organic acids via the Embden-Meyerhoff-Parnas pathway and several of its branch pathways, resulting in dental caries, while alkalization and acid neutralization via the arginine diamase system, urease, and so on, counteract acidification. Proteolytic and amino acid degrading bacteria, including Prevotella and Porphyromonas species, break down proteins and peptides into amino acids and degrade them further via specific pathways to produce short-chain fatty acids, ammonia, sulfur compounds, and indole scutol, which act as virulent and modifying factors in periodontitis and oral malodor. Furthermore, it is suggested that ethanol-derived acetaldehyde can cause oral cancer, while nitrate-derived nitrite can aid caries prevention and systemic health. End quote. From N. Takahashi in Journal of Dental Research, 2015, December. Quote, high sugar intake creates an increase in reactive oxygen species and oxidative stress in the hypothalamus. When this signaling mechanism halts or reverses the dentinal fluid flow, it renders the tooth vulnerable to oral bacteria, which can now attach to the tooth surface. Vitamin K2 has been shown to have an antioxidant potential in the brain and may prove to be a potent way to preserve the endocrine-controlled centrifugal dentinal fluid flow. End quote. From K. Southward. In Medical Hypotheses, 2015, March.